One of the most common questions we get here at Weill Cornell is, what exactly is health informatics? To start answering that, I'd like to turn it around and ask you what you're interested in. Are you interested in how doctors make medical decisions or how patients use medical information? Maybe you're interested in discovering new patterns of disease and health in big data sets or making data-driven predictions about people's outcomes. Maybe you're more of an entrepreneur and you're interested in whether doctors would use some technology innovation, and in fact, which innovations will go viral and which ones won't. Maybe you're interested in improving the quality and safety of healthcare through engaging and empowering patients through apps and websites and social media. Or maybe you're more focused on the usability issues of trying to make health information technology more useful and usable for the people who need it. If you're more of a policy person, maybe you're interested in understanding and improving federal and state policies about how we get access to health information, how we share it across organizations, how we get it in the hands of the patients. Overall, maybe what you're interested in is getting medical information to the people who need it in the right time, in the right format. If that's the case, I would say you're interested in health informatics. Health informatics is the application of information science and information technology to improve health and healthcare. In health informatics, we study and develop and improve ways to use information in healthcare. We see health informatics as the intersection of three areas. One of them is health and healthcare. One of them is information science and technology. And the third is social and behavioral sciences. We need to understand the people who provide the data. We need to understand the people who are going to use the data in order to make sure that any information innovations are used and are useful. To give you a better sense of how health informatics works, I'd like to introduce you to a couple of the different professors in our department. Dr. Dajung is a researcher in our department who analyzes electronic medical record data. One of her projects is to create patient clinical trajectories. That means to group similar patients together and to create pathways so that you can look into the past of individual patients, and you can also make projections about how this patient might do in the future. Another one of our professors is Dr. Ruth Masterson-Krieber. She focuses on the patient experience. She develops apps that help patients manage their own health and their own health care. And she's in the middle of a clinical trial to assess whether these apps actually improve people's health. In addition to research and teaching, our faculty also run the medical center's information systems. That means that they run the electronic medical record, the electronic patient portal, all of our clinical decision support, our business systems, the privacy and security issues, and our clinical research databases and software. That also means that they're in charge of our medical library, which is one of our most important information systems. If you'd like to find out more about health informatics at Weill Cornell, I'd invite you to take a look at our website. The URL is right here. You can see our curriculum, our requirements for admission, and answer some of the questions about types of research and other activities going on here at Weill Cornell. And I would be very happy to answer any questions that you might have. Thanks so much.